Good afternoon, everyone. You're welcome to this grand round. I'm Dr. Hilary Rumaso, second year psychiatry. The patient I'm talking about today is a 20-year-old female from Naweru. She's a Muslim in Uganda, and the informant was her mother, and but the next of kin who wasn't present during the interview was her husband. However, they are not legally married but cohabiting, and she stopped in S2, but after then she went for a tailoring course. She presented we saw this patient when we were rotating in neurology in Kirudu, where she had been referred from Kawempe Hospital with suspected pulmonary embolism during pregnancy. And she had about 18 weeks of amenorrhea at the time of examination. And the complaints were mainly headache, dizziness, and breathlessness, which had been there for a day prior to admission to Kawempe Hospital. However, this headache was different as it was associated with an aura. You all know what an aura is. And this aura will be discussed quite in details. However, this was similar to what she was having before. So it wasn't the first time the aura was happening, and at that time she wasn't with the mother. So, but when they called the mother and said, she has this thing, what they used to describe, the mother said, okay, I know that, you bring her to me. So she, of course, this time it was, I know what you see. She would see these people in white clothes, people that she couldn't recognize. She didn't know, but she could see, but she couldn't identify who they are. And the mother took her to a nearby clinic. They used to stay in Kawempe there. But in the clinic, they reported that the fetal movements weren't being felt. They did an ultrasound scan, which they couldn't, I think, read properly. So they had to refer urgently to Kawempe Hospital. So in the clinic, she was given first aid, which the mother couldn't clearly say what it was. And there was no significant improvement. So in Kawempe Hospital, they did all examination and the necessary investigation to rule out what they thought was the pulmonary embolism. And all examination and investigation findings, they didn't find anything abnormal. They still diagnosed as a PE, and then migraine, and then eventually they referred to the neurology clinic in Kirudu. They were given only 100 milligrams of tramadol to make sure she reaches Kirudu intact. And in Kirudu, the admitting clinician made the provisional diagnosis of conversion disorder, and they sent to the ward. So we saw this patient while on the ward. She was actually, she didn't receive so much treatment in Kirudu, but because it was a conversion, they would come, class, and pass. So the day we saw her, I think it was a Monday, having been seen all over the weekend. So we took detailed history, and we were informed that she has been having this kind of episodes of headache and the aura since she was 13 years old. And remember we said she was now 20. And she feels that something is about to happen. She starts seeing these things. In this instance, she saw a white woman, a woman in white clothes. So, and then she falls. So even this time, she saw this woman in white clothes who happens to enter her body. She sees this woman, and the woman disappears into her body. Then for her, she blacks out, and she doesn't basically feel anything. Whatever is reported, it's the observers who report them. So the first time it happened, she spent 2 days in what they called was a coma, but she was breathing, and she was only that she wouldn't be aroused. So she regained it after 2 days, And what they reported was that during that blackout, the head would turn and face backward, if you can imagine that. The chest would bulge. If you have seen a pot, the chest would bulge and they become so big like a pot. And during that time, there is no functioning at all. However, when she regains consciousness, she would return to normal functioning, and she wouldn't remember what happened. So for her, she has no recollection of whatsoever of what would happen during that blackout. Subsequent episodes, of course, she had multiple episodes thereafter, and these other subsequent episodes involved different unknown people and the animals entering her body. One day she would see an old woman, another day she would see a young woman, the other day she would see a snake, then lions. She saw so many different things, all disappearing into her body. This thing started when she was living with her aunt. I said at around 13 years. Then at about 14 years, first she spent that whole year sick. But they didn't report that they sought any treatment. So at about 14 years, she was taken back to her father. They had separated then with the mother, and the father by this time had the third wife. The father told the child that it was the cultural spirits that were disturbing her, and then he decided to start administering his own form of treatment, which included locking her in the house and repeatedly defiling her. Now this continued for a long time. This child had at one time became pregnant, but it was aborted, and during that period, this stepmother also left home. This child also underwent a lot of physical torture. She was beaten, she was insulted, and she was repeatedly tied on the bed in the house, and sometimes going several days without meals. And at one time, the condition deteriorated, and then she was taken to the nearby hospital. They used to live in Masaka then. She was taken to Villa Maria, from where she improved. Of course, then the mother had left, but a concerned neighbor called her and said, your child is taken to hospital. So she came and visited, and when she saw and was told what was happening, she took the child with her and came back to Kampala here. So this went on for some time. Even when the child was brought to Kampala, it continued going on. It reached the time when the mother started, because these things, when they enter the child, they say, at one time they started talking, demanding the child to go back, and the father also had the other demands that the mother reported that the child used to say, all these things used to say. But the mother started arguing them, said, no, I'll not give you my child. If you want that, you come and take me. And she reported to actually talking to these things. And once she refused on many occasions, these episodes started reducing in frequency. And of course, the child reported she felt bad at certain times. She felt helpless together with the mother, but she was hopeful. She thought about ending her life, but because she had the support of the mother, she never attempted it, and she never reported any other alcohol or substance use or abuse. So in the psychiatric history, because it was a long period of torture, they sought help from various places. They went to traditional healers, they were Muslims, so they visited so many sheikhs. They had a lot of du'as recited for them. But she didn't limit herself to only sheikhs. She also went to other religious organizations, pastors. I'm told she went up to Bukarango and other prayer mountains, but these things didn't go away. She would use a lot of medications, which were mainly herbal, and the various concoctions from these other different places that she sought help from. She had never sought any psychiatric help. It never occurred to her that she would seek psychiatric help. And even when we met her, it was in Chirudu, and they never reported any other mental or medical illness. They reported to have been hospitalized in different clinics many times, but they didn't receive help as they thought they would. However, this patient had no other medical conditions. Said they didn't report any epilepsy, they didn't report any other medical or even surgical condition. The patient was HIV negative. It was done in hospital there, it was negative. And they reported no other infections, including STIs. And she had never had any surgical procedure done. Like I said, she was cohabiting with her husband, and she was carrying her second pregnancy. The first one I reported, she had aborted. And the ultrasound scan done in Kawempe showed 22 weeks of amenorrhea. And she's the second born out of 60 children. However, 4 from both the father and the mother. The father had 2 different children from 2 different women, other women. The mother was remarried, but she didn't have children where she was. And this was the only girl among those 4 children. They reported that among these 2 other children, one was a girl. But among these 4 children, one child had died of a febrile illness that they couldn't describe very well. They said they had a fever, and before they went to hospital, the child died from home. And another child, who was a boy, went missing with the father. So they were not sure whether he was still alive or dead. The father went missing after running from the law. The time that this child was taken to Villa Maria, of course the local leaders and the police came hunting for him, but he went missing then. So he went with one of the children, and they have never been seen or heard from again. The father, both the parents reported, well, the mother who I talked to reported to have had a lot of marital problems, which included the fights and the insults. And this became too physical, and eventually they separated. However, as this child, this was when they were growing up. So they witnessed this, they saw what the parents were going through, and they also experienced it themselves, being beaten and being tied in the house for quite a long time. So both of the parents were remarried. The father, of course, twice afterwards, and they all ended up separated. And at the time of examination, they didn't know where the man was. And so the mother took custody of the girl and the other boy who had remained, the firstborn. And she reports that she was now strongly attached to both of those children, as she feels she needs to protect them. So, like I said, there is strong forensic history from the father, who actually went missing from the law. And the patient himself didn't report any psychiatric, any forensic history. And there were no other conditions reported. So, apart from the marital stress during pregnancy that was being meted onto her by the father, she reported the normal delivery, but by a traditional birth attendant, and she reported otherwise normal pregnancy, and she didn't report any other complications before or during the labor. And the child grew up normally. There were no reported childhood illnesses, and the milestones were quite normal as they were reported. However, the child is reported to have witnessed and experienced these marital conflicts that were ongoing. He herself experiencing torture. So she started school at 4 years, and she had normal progress until the age at which she started experiencing these conditions that we reported. And she was in P6 at the time, and she had to repeat because she wasn't doing well. She wasn't attending school at that time. And during P7, when she was 14 years, she couldn't perform very well. So she performed poorly in P7. She actually had the 4th grade. However, she still proceeded to secondary school, although she didn't go far in school because of similar illness. She went to UDEL. I think most of you know where it is, and to do a certificate in fashion and design, and she finished it. And that's where she had a good number of friends, and that's where she went. She actually met her future husband, and she didn't report any leadership in school. So in mental state examination, she was a young lady, well groomed, and she appeared to be in good nutritional state. She had the nicely plaited hair, nails were polished, clothes were clean, and she had no anxiety symptoms. She had no sweat hands or palms. She was seated still in her bed. She was calm. But although she had occasional frowns, but she was cooperative, and she had normal psychological activity. She had a slow speech. It was quite very slow. It was low tone. Had low volume and rate, and sometimes would be prompted to speak. She would ask her something, then it appears that she's thinking about it until you remind her, and then she would respond. However, there were no other speech disorders that we elicited. She reported to be sad because of the past experiences, but the affect appeared to be normal, which was incongruent with what she reported to be feeling. Because she had reported to having suicidal ideation before, we administered the 3rd-person scale, but she scored the 2, which was very low suicidal risk. The thoughts she was quite slow to think. However, she had a normal stream and flow, and she was quite coherent. But she seemed preoccupied. Like I said, she would take long to respond, and basically it seemed that she was thinking about the answer. Then she would kind of get lost in the thought until you prompt her to, then she would answer. However, she had no insertions, withdrawal, interference, broadcasting or echo, and she had no delusions. There were no hallucinations, but had the personalization because she was becoming possessed, and she believed that she would become someone else. And then derealization, when she's possessed, she believed she would be taken to the spirit world. And then whatever would happen is what the mother would see, although she had no recollection of that. Cognition, she was fully oriented in time, place, and person. Memory was intact. Attention and concentration was slightly impaired. Well, she needed prompting because she wouldn't sustain a conversation. You just needed to nudge her to be able to continue with the conversation or the interview. General knowledge was not up to date. Of course, she knew the president of Uganda. She didn't know who the prime minister or vice president was. She didn't appear interested in answering those questions, so we went on. However, numeracy was quite fair according to her level of education. Judgment and abstract was quite fair, but insight was a bit lacking. She believed that there is a problem with her, but she didn't believe it was a mental condition, although she still needed help. She needed help with whatever was going on. So whatever help was coming, she was up to that. So we made a provisional diagnosis of conversion disorder, dissociative disorder, and PTSD. Conversion because of the physical symptoms she reported, and then dissociative disorder because of the derealization, depersonalization, and then PTSD. She didn't have the reenactment of this previous trauma, but because of the strong history of previous trauma, we thought we would include it and investigate further. And then we did all the biological investigations here imminently. One more slide. Then we didn't find any abnormality, and we referred the patient to Dr. Nachibude for psychological investigations. And she made a diagnosis of dissociative identity disorder, and she'll be talking about it. And psychotherapy, she's the one who did it. I didn't handle that. So thank you very much.